So polycystic ovary syndrome, or PCOS, affects about 10 million people in the world.
It is a leading cause of infertility as well, and the exact root of the health condition is unknown. But September is PCOS Awareness Month, so let's bring in Mercedes Verde now. So just break down this condition and tell us what we should know.
Yeah, there's a lot to get to here, but in short, PCOS is a hormonal disorder. Patients with the condition have high levels of androgens, also known as male hormones, a lack of progesterone, and they have insulin resistance. Now, we mentioned people with PCOS are more likely to have type 2 diabetes, high cholesterol, heart disease, and many other health conditions you see on your screen right there. Experts say the disorder affects reproductive age women, and there can be an emotional and mental health toll as well, because some of the symptoms can be visible to people, including weight gain, acne or oily skin, male pattern baldness or hair thinning, and excessive hair on the face or body. Now, Dr. Andrew Wong with Hartford Healthcare says the symptoms can also impact other parts of your life.
Sometimes because of the extra weight, that can cause sleep apnea. And so when we don't sleep well, that can also cause depression and anxiety. And just also the social pressures that we have nowadays in today's society, that sometimes people are just kind of shamed into feeling that they're not trying hard enough when the reality is that they have a medical condition.
It can absolutely be so difficult. So what can patients do? It's important to point out there is no cure, but birth control, surgery to simulate ovulation, and lifestyle changes like eating healthy, working out, and getting enough sleep can help. Dr. Wong says it's also good to have a support system. So mypcosteam.com, we found that during research, and it's a good resource for everyone to have.
Yeah. So about 70% of patients go undiagnosed, right?
Yeah, that's true. And it's so heartbreaking for women to go undiagnosed. And when you go to a healthcare provider, Dr. Wong said maybe a doctor doesn't know how to spot for it. Or if you don't go to a doctor, maybe you haven't like paid attention to the symptoms.
Sure.
You've ruled them as normal.
Mm-hmm.
All right, good information to have, Bree. I know a lot of people are waking up and seeing that for the first time, and that's what the month is about, to raise awareness, and that's what you did, so we appreciate it.
Yeah, and if we alerted one person at home today, we did a good job.
Yes, absolutely, and made them feel less alone. So thank you, Bree.
Of course.